Did you know that nutrition can be an excellent tool to manage your metabolically challenged horse? Common metabolic illnesses are insulin resistance, laminitis, and obesity. When all three conditions are present simultaneously, it is also called Equine Metabolic Syndrome, EMS. A common disease in older horses is equine Cushing's or PPID, which is a dysfunction of the pituitary gland, resulting in a hormonal imbalance. All metabolically challenged horses are sensitive to fluctuating blood glucose and insulin levels, which are typically elevated after intake of a meal, in particular when the feed is high in starch and sugars. Therefore, feeds high in grains and molasses, such as sweet feeds, should be avoided. Remember, starch and sugar are both degraded to blood glucose, so always look at both values when comparing feed tags. So how should you feed your metabolic horse? Forage should always be the foundation of your horse's diet. To prevent feeding forage that is too rich, it's important to know its nutritional value. A hay analysis can help calculate your ration. Be careful about turning your horse out on pasture, since it's difficult to control calorie intake. Grass might also be rich in sugars at specific times of the day and year, in particular during times of cooler nights, followed by sunny and warm days. In case of a forage-only diet, be sure to meet all other nutrient requirements, which can be done with a ration balancer or supplements. If obesity is not a factor, you can add a low-starch, high-fiber fortified feed, or a feed that's higher in fat when extra energy is needed. In addition to a proper feeding program, it's important to manage the horse's weight. And don't forget, physical activity improves many metabolic disorders. Combine exercise with the right nutrition for a happy and healthy horse. Need further advice? Contact your nutritional partner, Cavalor. Feel free to call us on our consumer line.